Okay, so here we're looking at the base of the skull. And this area right in here, this is the infratemporal fossa. Okay, right in here is the infratemporal fossa, and this would be V3 territory. In fact, this is foramen ovale right back here. So V3 comes out foramen ovale and enters this infratemporal fossa. This is foramen spinosum right back here. Remember, the middle meningeal artery goes through there. So when V3 comes out, one of its big branches is auriculotemporal, and that splits to go around the middle meningeal artery going through spinosum. Now, the red wire right here, this basically represents the course of the maxillary artery. And the maxillary artery is crossing the infratemporal fossa from lateral to medial. And right here, this opening, this doorway, this is the pterygomaxillary fissure. And the maxillary artery is going through the pterygomaxillary fissure. That's the doorway between infratemporal and pterygopalatine. It courses through the pterygopalatine, and then it emerges on this side through the sphenopalatine foramen. Now, you see this big opening right here. That bone has been slowly chipped away over the years. The sphenopalatine foramen is usually not that big, but the maxillary artery is coming out of it right here. So what you have to realize is that between my two fingers right there, that's the pterygopalatine fossa. Okay? That's the pterygomaxillary fissure there, and the sphenopalatine foramen is over here. And it's between these two where you have the pterygopalatine fossa. Okay, let's flip over to this side. In green right here, and it's a very small little opening, the green represents the greater petrosal nerve. The greater let me move it just a tad. The green represents greater petrosal. It's coming out of an opening there, the hiatus for the greater petrosal nerve. It's running in a groove for the greater petrosal nerve, and it would be running underneath the trigeminal ganglion right here. And it's going to cross foramen lacerum. This is foramen lacerum, and this tiny little opening right here is the pterygoid canal. Okay, the green wire is going through the pterygoid canal. That would be the nerve of the pterygoid canal. And then it winds through the skull, and if you see the green wire coming out right there, that would be entering the pterygopalatine fossa down in here. Okay? So the green wire, again, represents the greater petrosal nerve going through the pterygoid canal, where it would now be the nerve of the pterygoid canal, entering the pterygopalatine fossa. You should realize that the pterygopalatine fossa here, and that sphenopalatine foramen is the doorway between pterygopalatine and the nasal cavity right here. Okay, the little red wire right here, that represents the chorda tympani coming out the petrotympanic fissure. Chorda tympani coming out of the petrotympanic fissure right there would be eventually joining the lingual nerve. Okay, let's go back to inside the skull. The trigeminal ganglion would be sitting in here, and V1 would be going out the superior orbital fissure. V2 through foramen rotundum. Okay, when you go through rotundum, you're in pterygopalatine. And V3 out foramen ovale right there. Okay, V3 out foramen ovale. Look at the black wire. The black wire represents V2 going out foramen rotundum. And if I turn it over, you can see the black wire deep down in the fossa here. Can you zoom in on that just a tad? Okay, right there. There's the black wire coming into the pterygopalatine fossa and crossing across the top of it as the infraorbital nerve. And the infraorbital nerve is getting into the inferior orbital fissure. Okay, and if we keep following it, we look into the orbit here, and there we can see the black wire that's representing infraorbital nerve, and it actually comes into a groove for the infraorbital nerve, and then a canal, and eventually emerges onto the face here as the infraorbital nerve. Okay, so you can find that infraorbital nerve on yourself. Don't do it now. But if you go to the middle of your eye, take your finger and drop down and palpate slightly below that, that's your infraorbital nerve right there. And the branches come out and go to the upper lip, the lower lid, to the side of the nose, and the front of the cheek area here. Okay, now, here's the chicken bucket. This represents the Terrigal-Palatine fossa. And let's do it like this. This would be the lateral wall of the Terrigal-Palatine fossa, or the lateral opening. This would be the pterygomaxillary fissure right here. This would be the sphenopalatine foramen. So the maxillary artery is basically going across like so. Okay? This would be infratemporal out here, pterygomaxillary, pterygopalatine fossa, sphenopalatine, and then nasal cavity. Okay? That's the course of the maxillary artery. V2 comes out foramen rotundum, enters the fossa, and keeps going anterior through the inferior orbital fissure onto the orbit. So this would be the orbit over here in the middle cranial fossa back here. Now you see the opening at the bottom, going down at the bottom of the bucket. That would be the greater and lesser palatine nerves dropping down to get to the oral cavity. And then all the way on the back you have the three openings. First is foramen rotundum. Then you have the pterygoid canal. That would be the nerve of the pterygoid canal coming through there. And then the palato-vaginal canal. So those are your openings there. And let's stop there. The end.